Courageous Doctors is a newscast about healthcare topics of concern to everyone. From health and safety tips to recall notices and medical news. Here's your host, Dr. Barry Prystowsky.
Hello, and welcome to Courageous Doctors, the radio show for you and your doctor. We're still not back on TV yet, but hopefully soon. And in the meantime, we've enjoyed all your correspondence, so please keep it coming. On today's show, we'll cover COVID updates. We'll look at government updates with Obamacare, and we'll look at other health information, and finally have some fun with some interesting health notes on feeding. So let's begin with COVID. Well, the Washington Post commented from the CDC that the Delta variant is, of course, now the nation's higher viral load. And we even see it in vaccinated people who aren't sick enough to really go in the hospital, but they can still pass it on. They get a mild infection, if any. And, of course, more children are in the hospital now. And the Star-Ledger said that we have anywhere from, in New Jersey, 500 to 1,000 in the hospital now, and some of those are children, 100 or more in the ICU. And the medical press said from the Journal of Nature that one third of Americans were infected last year in 2020, the first year of the epidemic. And of course, our tendency to spread was 1.4 last week. It's down to a little over 1.0 now. And, you want to get it less than 1.0 for spreading. Let me just take a second and editorialize on this a little. I'm going to speak as a general pediatrician from my experience in the office. Sometimes it's hard for you all when I'm talking to you to get a grasp of all these numbers. I mean, if you think about it, we're a year and a half into this. Last year, we were seeing 8,000 people in the hospital. Now we're seeing between 1,000 and 2,000. We were seeing 1,500 in the ICU. Now we're seeing, maybe less than 400 in our 70 hospitals in New Jersey. Now we're seeing more children in the hospital. Last year, even though the children got sick, they, for the most part, weren't in the hospital except those that had what we call the multi-inflammatory syndrome, which was where they were very sick and some needed the ventilator and had heart problems. But let me try to put this in perspective because, people are thinking, oh, it's not as bad as last year. I'll tell you the way I look at it. I'm not about to take my mask off, and let me tell you why. Because it's a deadly flu. In the past, we're still seeing between 8 and 15 people a day that are dying in New Jersey, and that's been there right for the whole year and a half. So, yes, it's true. We're not getting as many. We had over 500,000 people died the first year and less than 250,000 people the second year. That's true. Less people are dying. But right here in New Jersey, which is better at this point than most other states, which are overwhelmed in their hospitals due to the Delta variant spreading so fast, we're still seeing the same number of people dying each day. Okay, so, if we had a normal flu epidemic and people started dropping dead, people would be banging on my door to get flu shots. We're so numb and used to people dying in this country with this horrible killer flu called COVID that we're just, saying, oh, well, it's not 8,000, it's 2,000 in the hospital. Oh, well, we're not dying at 40,000 a month anymore. Now maybe, 1,000 a month or something or whatever it is. We're so numb, but think about it. It's the killer flu. Now, why we're still getting the same death rate, even though we're a lot better vaccinated in Jersey. We're over 70% vaccinated, almost 6 million, and a lot of those are starting to be the 12 years and older. I myself have been giving the COVID shot to my teenage patients right here in the office. I really don't know. I know the Delta variant is not more deadly. It's just more transmissible. And possibly because it's more transmissible, therefore more children are actually getting sick. And with more children getting sick, some are going to go in the hospital. I'm not sure if even the experts know why more children are in the hospital now. I think because most of the older adults are vaccinated, it's mostly those unvaccinated younger adults that are in the hospital. It's hard to say, but I lost a lot of people last year that were my age who died that I knew, doctor friends, parents, and grandparents of my patients. A lot of people that survived are still dealing with neurological problems and never feel the same. They're still weak. I myself, I'm still a little weak. I had it last year. I think that all along, what people don't realize is even in the beginning when you didn't have all these children in the hospital, I was still seeing right from the beginning teenagers who were short of breath and really scared and very sick. It's just you didn't hear about it a lot on the news because so many adults were dying. We had over 500,000 people die in 1 year. You didn't hear about the few teenagers, but I saw them in my office. So I've been seeing from the beginning teenagers extremely ill, but not ill enough to be in the hospital, but were short of breath, scared, and weak. My own staff who are young in their 20s, I thought should have gone in the hospital, but they managed to stay out, some were out for months. So I think we've been seeing the severity of this killer flu even in the youth. It's just more pronounced now because more of it is spreading and less of the older people are dying. But for me, I come back to what I said before. It's a killer flu, and I ain't taking my mask off until people stop dying. Anyway, so that's my soapbox, and it's just for all that it's worth. Okay, let's go back a little more on COVID. Health Day says that 1/4 of people continue to suffer more than 6 months. I just mentioned that. Star Ledger, I mentioned that we're 70% fully vaccinated. A couple other interesting articles. Helio talked on the vaccine causing a capillary leak syndrome was in the Annals of Internal Medicine. And yeah, we know some reasons why people clot. They have edema, they have sepsis-like picture, they have heart problems. There are reactions to these vaccines, but overall the government feels, the CDC, FDA, National Institute of Health, they feel, and private researchers, that if you have something like, 1 or 2 out of 1 million having a vaccine reaction, these same reactions, you're more likely to be hurt and even die, maybe, much more frequently with the disease itself. Like even with the kids with getting myocarditis, the teenagers from the Moderna or Pfizer shot, even if it's 1 out of 5,000, it's still much more common. If a teenager gets sick in the hospital, they're going to be even more severely hurt by the illness itself. So again, playing the numbers game, it's not a perfect shot, but you have to go with the brilliant minds that are looking at all this research. They're telling us, yes, some people have gotten hurt, some people have died from the shot, very rare. Most people, the reactions go away and they don't get hurt, but the disease is out there. It's a killer flu. As I said, I'm not taking my mask off. And people are still going in the hospital and dying. And so, you take your chances where you are, but just interesting to put some of those numbers around. Okay, let's move on to government stuff and talk about Obamacare updates and other government things. Bloomberg News says that 4 million are now on the Affordable Care Act and 1.5 million joined since February, when President Biden extended the deadline. And President Biden has, with his stimulus money, has made premiums on the Affordable Care actually decrease by 40%, and that's excellent. Washington Post, Biden has given an executive order to try to decrease drug prices. He wants states to negotiate directly, like with Canada and wherever, to get lower prices. And he's directed the Federal Trade Commission to ban pharmacies from blocking either their generic or other companies' generic drugs from coming out by trying to bribe them off. Star Ledger, the governor in New Jersey, signed laws on, we've had problems with lead pipes. He signed laws that it's mandatory to begin to replace these pipes. and he's targeting specifically houses built before 1978 that have to be inspected. And the Department of Environment is now serving violations. This isn't lead, this is water pollution, to companies that pollute the water with polyfluoroalcohols. Oh, this is interesting. The governor signed a law that we can now get home visiting nurses to go to all homes of mommies that give birth for the first couple of weeks. I was very glad to hear that.
Don't go away, there's more courageous doctors after these messages.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Wax Den is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
Courageous Doctors continues with Dr. Barry Prystowsky.
Okay, let's move on to other healthcare news. I always like to start this with recalls. This is interesting. McCormick, we all use their spices. McCormick has salmonella poisoning. Now, remember, as I say with all the recalls, they may have been recalled. Just check and make sure with your store that the recalled, what you're getting is not a recalled product. But again, these things are all coming out late, so a lot of this is probably done with. But salmonella was found in Perfect Pinch Italian, in Culinary Italian, and in Frank Red Hot Buffalo Ranch. Let's move on. Omaha meat processor had E. coli infecting his meats. You know, a lot of us get Omaha meats. It's really good company. Fox Business has several recalls. Muffins have listeria. They were sold in Walmart, 7-Elevens, and Stop and Shop. There was a carrot recall with salmonella. Bunny Love Organic cut and peeled baby carrots and Grimway Farms. Again, just check. Make sure that yours isn't one of these. Frozen chicken packaging had salmonella. If you get frozen whole pieces, either pieces or whole chickens frozen, from Dutch Farms, Milford Valley, Kirkwood, Serenade. So just check and see if your frozen chicken was recalled. Hostess, you know Hostess, the company, their hot dog buns and hamburgers had salmonella. I don't know how it got in the bread, but it got there. Italian-style meats like salami, prosciutto. I'm not sure the companies, the CDC didn't say, but the FDA didn't say, but they had salmonella. Packaged lettuce is always a problem in salad greens. Had E. coli. We always see that. Arugula, basil, Fenster, green beans, romaine. Bright Farms and Old Soul Farms were the two mentioned, but again, I always check, wherever I go shopping, salmonella, E. coli, listeria are in a lot of these foods. I just always check anything recalled. It never hurts to ask. Oh, this is interesting. The Journal of American Medical Association says the government is now training farmers on good hygiene to try to stop the spread of cyclospora. Remember, cyclospora is one of those food poisoners also, and we get it in swimming pools. For example, farmers working with basil, cilantro, lettuce, raspberry, and snow peas. Their dirty hands were putting cyclospora on them. Oh, and let's not forget our pets. Dog food had salmonella and listeria, and the brands mentioned were Top Quality Dog Foods Beef HVM. Top Quality Dog Foods Beef HVM. And USA Dog Food had Fungus, and also Sunshine Mills, Triumph, Evolve, Wild Harvest, and Nurture Farms, and others. Okay, let's go on to other healthcare news. Our Department of Health is warning us their summertime mosquito and tick stuff is out. The West Nile virus, Eastern equine encephalitis, these are all mosquito viruses. We're starting to see that in Jersey. The Northeast always gets hit bad, so use your mosquito repellents. There's a warning from the Department of Health that Phelps ventilators, people on home ventilators or hospital ventilators, they weren't working. And, this is interesting, Burkholderia melioidosis, found in soil, water, air. If you have a skin cut and touch it, if you breathe it in, if you eat it, either imported or even home produce, can make you terribly ill. And I frequently will culture for Burkholderia. It's not that common, but it's just one of the things when you got a bad skin abscess or pneumonia or food poisoning that you look for. Let's see, what's this? Star Ledger. Oh, reminds us, RSV, that's right, it's here early. You know, our baby bronchitis, respiratory syncytial virus. It's here early like everything else. We saw croup out of season too. Kids were crouping in the spring instead of the fall. And now kids are supposed to have RSV in the winter, and now it's here at the end of the summer and the fall. So a lot of babies coming in ill with that. Associated Press reminds us that some nursing homes had fungus, and actually a hospital in Dallas and nursing homes in Washington. Some of these resistant fungal infections from resistant Canada are really scary. And lastly, the New York Times says we are now screening type 2 diabetes at 35 years of age. That's more for the internists. For us pediatricians, we're always screening for diabetes, but that's the internists are now screening earlier. They remind us that 1 out of 10 people in the country have diabetes, and 1/3 of all Americans have problems with their sugar. Okay, let's move on lastly to health and safety tips. I'll give you first the health and safety, and then we'll have fun with some other stuff. Okay, so let's see. Fox News reminds us, this is scary, infant deaths from boppy pillows and boppy infant loungers and nursing pillows. I just had a grandchild, Lenny and Jeff. Lenny delivered a couple days ago, and I know they're exhausted. She's breastfeeding, and I'm sure I'll have to remind her to see if she's using one of these nursing pillows. USA reminds us that sunscreens were recalled from benzene and octocrylene. Products like from J&J, Aveeno, Neutrogena, Coppertone, Banana Boat, Edgewell. I know the summer's coming to an end, but many of you are still off at the beach, so just be careful you don't have one of the recalled products. The medical press says that be careful with our young women that don't know to get safe menstrual products. They probably don't remember. When I first started practice almost 40 years ago, we used to see things like the women's menstrual protective products were infected with staph and all. And I saw some people get very ill from it, almost died. I thought all that was behind us, but now for some reason, I guess we have to be careful we get safe products again. Let's see, Star Ledger, talking about insect repellents. Oh, this is interesting. First of all, you're not allowed to use them less than 2 months old. I don't know if you knew that. So 2 months old, or you have to be over 2 months. And you know, you got the DEET. This is interesting. 30% will last 5 hours, and that if you use over 50% DEET, it gives no extra protection. So you probably want at least 30%. You put it on the clothes, you put it on their exposed skin, but don't put it on their hands. They might wipe their face or eyes. If you really want it on their face, you wipe it on. Don't let them wipe it on. And of course, when they come back in, wash their clothes, bathe them. You don't want the DEET to still be on them. Picardin is an alternative. And they mentioned that even though there are others that are safe, they're not proven to be as effective. Like they're mentioning citronella, geranium, peppermint, soy oil, and soaked wristbands are safe but aren't as effective as DEET and picardin. They said don't spray in the open air because you might inhale it. Don't use those candles for mosquitoes because you might inhale them. And don't mix it with sunscreen in a bottle because you have to keep putting on the sunscreen and you might poison them with the DEET. Okay. Star Ledger talks about food safety preparation. This is always important. I know myself in the kitchen, I'm always very careful with washing everything. They say for your cutting boards, keep them separate for meat and vegetables. A lot of times we get lazy. I guess, but you don't want raw meat and vegetables mixing. Use separate utensils for your meat, but when you're cooking for your raw meat and vegetables, you don't want to mix raw meat with your vegetables or fruit or anything. You want to thaw your meats, this is interesting, in the fridge and not on the counter. I did not know that. Thaw your meat in the refrigerator, not on the counter. Don't wash your chicken or meat in the sink. I've heard that before. Put leftovers quickly back in the fridge. A lot of us forget. You're having a party, you don't realize. Just say, okay, excuse me, run, put whatever they're not eating back in the fridge. It'll be good for 3 or 4 days, and if longer, just freeze it. Transport your meat on ice. And here's something you might forget. Cook all leftovers to at least 165 degrees. You got to get the thermometer, you stick it in. In general, your thermometer should read 160 for beef and pork, 165 for poultry, 145 for fish. And once you've cooked your food and you're just keeping it ready to serve on the table, make sure it's still staying at 140. Some pretty good tips. Oh, I like this. Star Ledger's talked on sleep habits. This is some good stuff. Teenagers should shut down their electronics 30 minutes before sleeping, and electronics should not be in the child's room, only in the teenager's room, but shut down 30 minutes before. Remember to not exercise, but end your exercise at least 2 hours before bed, and avoid late night sugars, no caffeine, soda, energy drinks past 3 p.m. Okay, one last thing. I thought this was helpful. We've had a lot of terrible storms and hurricanes. My daughter was in New Orleans, still is, with Hurricane Ida. I had office damage from Hurricane Ida up here. And, of course, hurricanes are going on even now. This is our season. And we often forget, we want to be safe. I'm part of the Medical Reserve Corps, and I help out in disasters. And some safety tips to keep your phone charged. I thought that was pretty interesting. This is from Washington Post. So it says, let's see, text rather than phone calls. It'll save your battery. Use the airplane mode. Shut down apps, including notifications and GPS. Don't use streaming. Turn off your phone if not using. Turn down the screen light. Use Wi-Fi preferred over cellular, if you know what that means. Keep your phone dry. Share your locations with other people in case you lose your phone so you're not all alone. Recharge your phone on a laptop or a cranked hand radio or in the car. And you don't even need to turn on the car engine. Just be careful you don't run down the car battery. Oh, some really good points. Okay, everybody, I had fun talking to you again. I hope, again, one day we're back live on TV, but I'll just enjoy talking to you on the radio. Enjoy a safe back to fall. Enjoy your pumpkin picking and everything. And please keep sending in your comments. I enjoy hearing, and we'll talk to you next time. Take care.
Courageous Doctors, Pioneers and Heroes. Executive producers Barry S. Prystowsky, MD. And Patrick M. Marucki. Post-production Patrick M. Marucki, makeup by Lisa McAllister, salon Jimmy Gerards. Music provided by VideoBlocks. Special thanks to American Medical Association and New England Journal of Medicine. Visit us on the internet at courageousdoctors.com.